Hi, today we are going to learn about iNBDE sample questions. Question 1. Patient, male, 13 years, chief complaint, pain in the upper back tooth region. In children, barbiturates leads to renal failure, contraindicator, it's a poor analgesic or respiratory failure. Answer, respiratory failure. While in children, the rectal administration of methotrexate sometimes is used for the induction of anesthesia or for sudden sedation during imaging procedures. The lethal dose of barbiturates varies, but severe poisoning is likely to occur when more than 10 times the full hypnotic dose has been ingested at once. In severe intoxication, respiration is affected early. Depression of respiration is coupled with central cardiovascular depression and result in a shock-like condition with a shallow, infrequent breathing. So, barbiturates breathing related to breathing. B. Um, barbiturates breathing, so it leads to respiratory failure. Answer, respiratory failure. Question 2. Patient, female, 5 years, chief complaint, discoloration of teeth. A 5-year-old child received a tetracycline therapy. Which of the following teeth may be affected? All permanent teeth are affected. Permanent canine, premolars and second molar, or all primary teeth. Fourth one, permanent incisor and canines. Answer, permanent canine, premolar and second molar. Because 5 year 5 year means all the primary teeth won't be affected. All the permanent teeth, sometimes it may be affected, but mostly the permanent canine, premolar and second molar are affected. Answer, permanent canine, premolar and second molar. Question 3. Patient, male, 13 years, chief complaint, pain in the lower back tooth region. Which of the following factors are primarily contributed to the shedding of deciduous teeth? Masticatory pressure, hydrostatic pressure, vascular pressure or oncotic pressure? Answer, masticatory pressure. The causes of shedding of primary teeth is loss of root, loss of bone and increased force. Loss of root is pressure from the growing and erupting permanent teeth which induces differentiation of osteoclast that leads to resorption of primary roots. Loss of bone, weakening of supporting tissues of primary teeth due to the root resorption and modification of alveolar bone. Also, there is a facial growth of alveolar bone which produces sufficient space for positioning of permanent teeth. Increased force. Increased masticatory forces on weakened teeth due to muscular growth. So, answer is masticatory pressure. Question 4. Patient, male, 40 years, chief complaint, pain in the lower back tooth region. The term prevalence refers to number of new cases of a disease or cumulative effect of a disease or rate of a disease. Number of old existing cases in a population. Answer, cumulative effect of a disease. Why? Prevalence means it's new cases in the disease and the old existing cases of in the disease. Sum of new cases and old cases is called prevalence. Prevalence, the prevalence the measures the both the new and the old cases as a cumulative effect. It represents the total proportion of the population affected by the disease, both old and the new. Propagation proportion indicates the count within the addition of denominator to determine the prevalence. The cumulative effect of the disease is the past and the present. Answer, cumulative effect of the disease. Prevalence is equal to sum of old cases plus new cases. Question 5. Patient, female 30 years, chief complaint pain complaint patient complains of pain in the upper front tooth region. The patient complains of toothache triggering by the heat and relieved by cold. That involved tooth is treated by root canal therapy, pulpotomy, antibiotics, or extraction of tooth. Answer: root canal therapy, because it is related to a reversible pulpitis or irreversible pulpitis. So for reversible and irreversible pulpitis, we can do a root canal therapy. The symptoms indicate irreversible pulpitis or reversible pulpitis, and the treatment is root canal therapy. Reversible pulpitis is aggravated by heat and relieved by cold. So it can be treated by root canal therapy. Answer: root canal therapy. Thank you.